Hey everybody, Gabby and I are really excited to be here with you today for the second,
Yeah,
right?
second.
Second of three virtual stops that we're making across Arizona to hear from seniors. So last week, I made my first virtual stop with seniors in Southern Arizona and they were from Sierra Vista and Tucson, Green Valley, also Yuma, where we discuss the earned benefits that many seniors receive and rely on to pay for groceries and bills and medications. Now, this time last year, I had the opportunity to travel to some senior centers in person all across the state, including one in Phoenix, where I visited residents and talked about the challenges, especially with regards to the cost of prescription medication. And a year later, these issues remain and have become more challenging for many seniors due to the coronavirus pandemic. Last week, I spoke with Joyce, and she was a senior from Green Valley. And she told me about the challenges that the coronavirus has created for seniors in rural communities who aren't able to make appointments because of a lack of transportation. They couldn't get from Green Valley to Tucson specifically. And I also heard from a gentleman named Henry in Tucson about how he's really feeling the pinch with the rising costs of prescription drugs. Now, this pandemic has been tough on Arizona seniors and seniors across the country. And that's why it's so important to me that Arizona seniors get the support that they need. And that includes protecting their Medicare and Social Security benefits. Social Security is a promise to American workers. And workers pay into it so that they can retire with dignity and security. But those benefits are under attack with plans to undermine funding for this program, risking the benefits that many Arizona seniors rely on. And if elected to the US Senate, I'm not going to stand for that. Even if I'm not elected, I'm not going to stand for that. That should be off the table. Not to mention concerns around delays with the US Postal Service. Arizona seniors deserve better. So before I kick it over to the panelists to introduce themselves, and by the way, thank you everybody for joining us today, I'm going to turn it over to the toughest person I know, who reminds me every day to deny the acceptance of failure, who never gives up, my wife, a former Congresswoman, Gabby Giffords, to say a few words.
This election is so important. Lowering drug prices, raising the middle class wages, protecting Medicare and Social Security. It's all at stake. That's why I'm here to support my husband, Mark Kelly. Mark focuses on facts, not politics. Mark is loyal and caring. Mark has already served our country in so many ways. Now we need him in the Senate. Thank you for being here today. It means so much to me and Mark. This is so important for Arizona, for our country. We cannot do it alone. Thank you, thank you, thank you.
No, thank you, Gabby.
Thank you.
Thank you for helping out today and for being here. We all really appreciate it. And I'm looking forward to talking about all these important issues with all of you today. And we've got a lot of folks watching, and we're going to record this so everybody knows this is recorded. We're going to share it later. So John, I want to start with you, and then we're going to go through each individual. And John, you're going to talk a little bit about yourself, where you are, and a bit about the work you're doing. And then from everybody else, we'll go off one by one, just where you are, and if you're affiliated with an organization, name, all that, just we'll go in order, and then we'll have an opportunity to discuss these issues that are so important to Arizonans. So John, over to you.
So I am John Bowser Bauman. Many of you probably know me as Bowser from the group Sha Na Na, but I'm also president of Social Security Works PAC. And I am here today because on the night of November 3rd, Mark Kelly has got to be doing this. we are endorsing Mark Kelly to be the next senator from the great state of Arizona. I urge everyone in the state of Arizona to bum 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 dang 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 ding dong ding, vote for Mark Kelly.
All right.
Thank you, John. And now let's go over to, I really appreciate that. I don't know if I could, I'm not even going to try. Election night. Roberto.
Roberto Reveles. I live in Gold Canyon and have been living here for over 26 years on retiring after 28 years of public service in the military and in the federal government. And I have been living a relatively comfortable life because of Social Security and because of Medicare. In November, 6 months ago, I suddenly was diagnosed with a need for open heart surgery. Surgery that came right before they closed down the hospital to take care of the emerging COVID-19. And so the challenge to me was, first of all, could I afford the open heart surgery? And thanks to Medicare, I was able to survive the financial emergency that faced me. And so I am distraught when I hear candidates for office saying that they agree with taking a look at the future of Social Security. And unfortunately, the candidates I'm speaking about are candidates who are not there to support those of us dependent on Medicare. And so I'm counting on the integrity that Mark Kelly, that you bring to the campaign. And I'm hopeful that you will help us.
Well, thank you, Roberto. And I want to come back and talk a little bit more in a couple minutes about your surgery and the support you got from Medicare. But let's just finish going around with introductions. Over to Fran, and then we'll go to Doug, then Dr. Tarkington, and then finally to Roman.
Hi, my name's Fran Krugen. I live in Peoria. I've been a resident here for 37 years. I'm the Secretary Treasurer for the AFSCME Retiree Local, and I have 2 children. One's a nurse and one is a first responder.
Thank you, Fran. Doug.
My name is Doug Hart. Lived here in Arizona now for 19 years. Retired from Chicago as past president of SEIU Local 1. Worked with AFSCME before that, and served for 16 years as president of the Alliance for Retired Americans. Do some consulting now with Labor First Retiree Healthcare Program.
And Laverne?
Yes, I am Dr. Laverne Tarkington. I am, along with my husband, we are actually, I would say, native residents of Phoenix, Arizona. We've lived here all of our lives, attended school here. I am a retired school administrator, high school administrator, in fact, and consultant. I work with a lot of community groups, my sorority, my church, my also other community service organizations. So I've held leadership roles in those, but that doesn't matter at this point. But though I am very involved in the community now with no pay.
And then finally, Roman.
Hi, my name is Roman Allman. I spent 30 years working for the city of Detroit. But when I retired, we built a house out here in Arizona because I wanted to be near God's mountains and the desert and all that sort of stuff, and love it very much. I am the state president of the AFSCME Arizona Retirees. I'm also active with the Alliance for Retired Americans. And I, for 4 years, was the president of the All Saints Parish Council. And so I have been working for retirees and for seniors literally my entire life, and has always hurt me so much whenever seniors have to struggle to make ends meet. As a matter of fact, I hate to even say this, but there were a couple cases where in the church, people who had been married for 30 years had to get a divorce. Otherwise, the medical bills would have destroyed the family. To me, that's unconscionable. And I think that's why we need to fight for seniors. And I appreciate what Mark Kelly's doing.
Yeah, Roman, that's not an uncommon story. I've heard, parents with young children who have serious health issues who have had to talk about that option. Also, adoption to another family member. These are complex issues, and we made some changes a number of years ago that are providing protections for people with pre-existing conditions that would often result in the situation that you mentioned. So we can't go back. We've got 2.8 million Arizonans who have some sort of pre-existing health condition. But I'm going to come back to you, and I want to hear a little bit more about AFSCME retirees in a second. But before I do that, I want to jump back to John here. So, John, first of all, how long have you been, doing this work in trying to protect Social Security and Medicare? And then can you just tell us, what are the current threats to funding that we're dealing with right now?
Well, Mark, I've been working on senior issues, and you and I have crossed paths along with Gabby on many campaigns. It's probably been about 12 years or so that I've been working on senior issues, and I've kind of turned myself into an expert on these issues. So even though, we can have some fun with music sometimes during campaign events, there is no fun about what's going on with Social Security and Medicare right now. In fact, Social Security is under the biggest threat that it has been in our lifetimes, probably since the inception of the program in 1935. First of all, let's make the simple statement. Before Medicare was passed in 1965, over 35% of American seniors had incomes below the poverty line. And before Social Security was passed, over 50%, more than 1 out of 2 of American seniors had incomes below the poverty line. Social Security and Medicare are the 2 most successful domestic programs in the entire history of the United States of America. And the current threat to Social Security, which really just came up a few weeks ago, is something to be taken very, very seriously by Arizonans and by all Americans. This administration in Washington really sent out a signal that that payroll tax, FICA, the dedicated funding of Social Security, could actually be deferred and deferred and deferred and deferred to the point where, I have it right here, the chief actuary of Social Security, Stephen Goss, wrote this letter that predicted that if this were actually done, Social Security would literally run out of funding in the year 2023. Disability insurance, equally important part of Social Security to the fact that Social Security keeps older Americans out of poverty, would actually run out in 2021. And there would be legal challenges to this way of trying to do things, but those legal challenges might not work. So this is a real threat. It's something that needs to be taken seriously by everybody, and there's only one answer to it, which is to elect better people. Mark Kelly is going to protect your Social Security, he's going to protect your Medicare, and he needs to go to the Senate. Mark runs a relentlessly positive campaign, so I'm not going to say anything about Mark's opponent and her 15% lifetime rating when she was in the House and 44% last year. They are both failing grades on senior issues from the previously mentioned Alliance for Retired Americans. But suffice it to say that Mark Kelly is the best choice for senior Arizonans, and it's not even close.
Well, thank you, John, for that. And what you mentioned about payroll taxes, it's not theoretical. Right now, the plan is this month, if you're a federal government employee, that payroll taxes will not be coming out of your check. So that funding stream, which is a contribution to Social Security Trust Fund, those will stop. Now, the plan is, to be fair, that there will be catch-up payments made later, but there's also been some suggestions by those in elected office that, maybe this is the first step to stop the funding, or some of the funding at least, for Social Security,
The
which,
President of the United States actually said he gave his intention to, quote, terminate payroll taxes in a second term. And make no mistake about it, termination of payroll taxes, which is really not a tax, it's actually your insurance premium.
right,
Social Security is an insurance program, which you pay into by way of your premiums. So during your working years, so number one, remember, this is your money. It's not the government's money. This is your money. And it goes into two trust funds, which cannot be touched. It's mythological that the money can be borrowed and never put back. That's false. So a lot of the threats that people think are made to Social Security are actually not true. But this one could really turn into a disaster, because theoretically, if he can defer this once, he can continue to defer it until the trust funds run out of money. And then where are we?
Understand. So let's go back to Roberto for a second. Roberto, you were talking about your heart surgery a little bit, and I'm just curious under Medicare. So Medicare covered the costs, but I imagine there are co-pays and deductibles. Did they add up to a significant amount? And if they did, what is the way somebody in your situation specifically can have some of those costs covered? Did you have like a Medicare supplement to do that?
I did. And thankfully, I've been rather frugal throughout my working life. And somebody who comes out of the Mexican-American community here, we're used to dealing with low wage income, if you will. And in any event, the cost of the surgery I underwent was over $250,000, $257,000. Thankfully, Medicare was there for me. Thankfully, supplemental program was there for me. And thankfully, I had been frugal and had to get into my savings as well. But without Medicare, I would have been bankrupt. And so most seniors are facing that same challenge. And if you take away Medicare, you are taking away our ability to continue providing for ourselves.
Understand. So Medicare is one issue, and often we find folks in government that want to turn it into a voucher program, which would provide less choices and more out-of-pocket expenses for seniors. But the other issue that I hear often, as I've traveled through all 15 counties, in person at first, and now kind of virtually, at least for now, is the cost of prescription drugs. So I want to go over to Fran for a second. So Fran, how has the rising cost of prescription medication impacted you?
Well, it's heavily. My husband was disabled for over 15 years, and he was diabetic. He had AFib, he had congestive heart failure, neuropathy in his hands and his feet, and it was due to a broken neck. And so he was on several medications. And sure, he had the supplemental insurance, but the co-pays on 10, 12 different medications, it got costly. And then when we fell into the donut hole with the Medicare, he was on insulin for his diabetes. He had to take 2 different kinds every month, and that shot up to $900 a vial. And he was on disability, but his disability income didn't even cover the 2 vials of insulin, yet alone all the other drugs that he needed for the heart failure and stuff. And that's exactly what we had to do, is go into our savings.
Now, there are current proposals, one of which that I support, which would be to cap the out-of-pocket expenses under Medicare Part D for prescription medication. And it's pretty clear that that would significantly help seniors afford the medication that they and their family members need. I've heard other stories of the price of prescription medication being so high where folks, specifically a mom that I was speaking to about a month ago, that would make a choice between her expensive medication her sons, who was disabled, and buying groceries for the week. And that's not a choice that individuals or families should have to make in our country. So, Fran, was there, do you have a similar kind of experience with Medicare? How has Medicare been working for you and your husband?
Well, as far as Medicare goes, you know, with all the things that he had, the congestive heart failure, he was on so many of the medications and so many visits to the hospital and stuff. Medicare was a great help. It picked up a lot of it, but we still had a lot of cost to it. And every time he would get sick, it was a hospital visit. There was nothing we could do. Being on the blood thinners for the congestive heart failure, if he were to get scratched, he'd start bleeding, it would have to be a hospital visit. And he'd have to stay there overnight to get the Coumadin and get his blood thick again and then thin it out so he could go home.
Mm-hmm.
And Medicare helped pick up on a lot of those costs.
Mm-hmm. And still today, it's often being threatened to pay for other things. So Doug, I want to come to you for a second. So Social Security has played a pretty important role in your life, even when you were younger. Even though you look still very young to me now, but even when you were younger, it played an important role. Can you talk a little bit about that?
I'm happy to. That's the reason I am fighting so hard for Social Security now. My father was in World War II, actually part of the original Army Ranger unit that was trained. There was 1,200 of them trained in England. 58 of them lived to the end of the war. My father was lucky to be one of those 58. He had 2 Purple Hearts, was shot up pretty badly, and died when I was 8 years old. He had just gone to school in the GI Bill and got out of vet school when he died. And so we had quite a few debts. But without Social Security survivors benefits, we would have starved. We would not have had a home. We would not have had food. My mother did the best she could, taking in laundry, waiting on tables to try to make ends meet. But to have 3 kids without that Social Security survivors benefits, we would not have made it.
Yeah, I remember a similar situation with one of my friends in high school who dad died when they were younger. And I remember stories from that individual about how Social Security benefits, the survivors benefits, is the thing that kept them, kept them afloat.
Well, that's the reason I think people have got to understand it's not just a retirement benefits.
Yeah.
It's for people that also need it for other areas.
Yeah. So thank you, Doug. So Dr. Tarkington, so I know that you've talked about your successful, career in education as an educator, superintendent. Could you tell us how Social Security and Medicare has impacted your life?
Well, yes, we have actually been fortunate, very fortunate up to this point where it has been there for us. Certainly the Medicare aspect of it has taken care of most of the things that have happened. But recently we've had my husband has an eye condition. And so the surgeries that he's had to have over the past several years, past 2 or 3 years, have actually impacted us greatly. And his medication now are so costly that we've reached the donut hole. And we are now paying a lot more than we would have anticipated. So I actually see the Social Security aspect of it helping us to be able to pay for the medications that he needs. I've also had to have surgery. And as Roberto mentioned earlier, we were very fortunate in that most of that was covered by Medicare. Otherwise, we would have been placed in a very challenging situation. So I think that what we're beginning to see as all of us age, things happen, and we're beginning to use the benefits that we expected, that we were paying for all the years that we worked, that we will now begin to reap those benefits. So that's how it's affected us.
Mm-hmm. you feel you're using your Social Security benefit to pay for the copays for the
Yes.
medication, almost.
Yes, because at this point, because we have now reached the donut hole aspect where we're paying a larger percentage, his medications are very expensive. He has an eye condition that it'll only get worse. And so we don't know what's going to happen later on. He's lost a lot of vision. Anyway, so we use that actually to pay for prescriptions that we have. Yes.
And explain the donut hole to folks for a second. So then when it gets to a certain amount, if it goes so high,
Yes.
then Medicare will start covering the costs again.
I was just ignorant to this fact before we reached this point. The donut hole was explained to me as to the point where they told us that we were going to pay 3 times the amount that we've been paying before. We reached the maximum for our health care benefits. It was $4,000 or so dollars, and at that point, we are now expected to pay 25% of the cost of the medication, which doesn't matter if you've got a medication that's not as expensive as I mentioned my husband's eye condition requires. Now, they explained to me, your husband, that medication cost $1,000+, and now 25% of that is our cost.
Mm-hmm.
And that will continue until we pay out, I think they mentioned out of pocket, at least $6,000 or more dollars before we can actually go back to reaping those, the 5% that I understand we're going to be expected to pay. But at any rate, I didn't know about it until we were told how much it was going to cost. And suddenly we were hit with that bill. So yes, definitely, our Social Security benefits will be paying for his medication.
Mm-hmm. Well, thank you, Dr. Tarkington. So, Roman, so interested in hearing about your AFSCME retirees here in Arizona. Have your members shared any concerns about how they're thinking about future potential cuts to Social Security and Medicare?
Actually, they are. And let me just say, as the president of AFSCME Arizona Retirees, it was our pleasure to be the first retiree organization to endorse you for election, to the Senate, because we need some fighters there. I mean, we need dependable people who keep their word. And I know when you go up on a space mission, if you don't keep your word, people suffer. So you're a very good word keeper. But let me tell you something. It's always a problem, whatever members you have, but more so when you have seniors, because they do come down with things. And I can't tell you how many times Fran had to take people to the hospital, or we had to help a senior handle situations like that. As a matter of fact, both my wife and I are cancer survivors. And Irene had her operation before we went on Medicare. And the doctor told her she had to have annual mammograms. Well, damn insurance company insisted that we pay for that. It's because it's preventive medicine, and says it's not. Doctor says it's part of the continued treatment, and had to fight with Blue Cross every single time. Well, I feel sorry for the seniors who have to contend with that kind of bureaucracy, because they will wear you down. Once we went on Medicare, it didn't matter anymore. Medicare paid for those annual mammograms. Medicare paid for my cancer, medications and what have you. And they keep their word. They don't try to nickel and dime you and cheat you and what have you. Medicare is there, and so is Social Security. And I can't tell you how much it helps us on Social Security. My mother-in-law used to live with us, and she only had Social Security, and she used to say, well, I don't have a house of my own. I said, Mom, this is your house. And she felt good that using that little bit of money on Social Security, she could pay her own bills, she could buy gifts for the grandchildren. That made her feel like a whole person. Seniors are one of the backbones of our society, because We go to our churches, we contribute. We go to the doctor, we pay our bills. We go to the grocery store, we pay our bills. If we did not have Social Security, we would have to be on public assistance. So taxes would still be paying our bills, but we would feel like, we were beggars or something. Social Security allows us to feel like citizens, contributing citizens of the United States. And, Trump likes to talk about, well, we got to help the small businesses. That's nonsense. My daughter owns a small business. She owns a hairstyling shop. And the best way you can help a small business is to give seniors their Social Security so they can go get their hair done. They can do whatever they need to do. And finally, I will tell you this, the one thing that really, really hurt me to my heart is my brother died at the age of 65. He just turned 65. He had lung cancer. He could not get the best treatment. He did not have Social Security. He did not have Medicare. He didn't have all the good things that help you out. And on his deathbed, he was already on dying. He was semi-conscious, and I came up to him and I says, Chet, is there anything you want me to do for you? And he says, yeah. You guys have Social Security. Other people have good health care. I have nothing. Make sure that everybody gets health care in America. And he died.
He was eligible to start receiving Medicare.
That very 1 week. He was 65 for 1 week.
Mm-hmm. I'm so sorry to hear that. And what we have to contend with often in the U.S. House and the Senate, but there have been votes in the House of Representatives that would essentially turn Medicare into a voucher program instead of what Medicare is today, which is a safety net for millions of seniors across the country. Over 1 million here in the state of Arizona alone. I think it's 1.1, 1.2 million seniors are on Medicare and Social Security. So we've got
Mark, I know one thing. It's great when you're dealing with honest and corporations that keep their word. Unfortunately, there are some corporations who don't keep their word, and then you got to fight them. And is that what seniors should have to do in order to get what they were promised in the first place?
Mm-hmm. Yep, you shouldn't have to do that. Let's talk about not a corporation, but a governmental organization for a second, the U.S. Postal Service. So I want to see just by a show of hands, how many folks get their prescription medication through the Postal Service? Anybody do that? Yeah, we got you. Oh, Gabby, I'm trying to think. You do a little bit.
Yeah.
Yes, Gabby does too, but not everything. So that's like 50%. It's a lot. That comes, if that is the rate across the country, that is millions of individuals. And we've got to worry about the Postal Service. They don't always get the funding they need to do their jobs. They're so reliable. I mean, we love our postman. They're also very popular. They do a great job. They've got to have the resources they need to do the work that they've been asked to do. And they're often treated, there's some things about the way the Postal Service is treated from a financial standpoint where they're required to put away future retirement benefits, unlike other government agencies do. So they often struggle financially. Got to make sure the Postal Service is available to get these medications to seniors and also to Gabby Giffords and others. Yeah, go ahead, Laverne.
Yeah, I was just going to add that I didn't realize the advantage for us to receive our prescriptions through the mail service, because through our supplemental insurance, that is the way actually that I end up paying less because of the delivery and the program that is offered. So I just became aware of this within the last year. And I think more people who find that out realize they're not going to pay as much. And then I don't have to drive to the drugstore as well. And through this COVID-19, that has been a major advantage. Not to be.
Mark,
we have
I've had my pharmacist tell me to don't do mail prescriptions anymore, because if the mail's slowed down and it sits around too long, it could alter the effects of the original medication.
Mhm.
So I stopped and go to the pharmacy now.
Well, thank you. Well, thank you, everybody. We are starting to run out of time, but I want to give John an opportunity here again to any final thoughts about where are we with our fight to protect Social Security, to keep it from going away, and also to prevent Medicare from turning into a voucher program. Can you talk a little bit about what's going on in Congress and how do we make sure that those things don't happen, that we protect these programs?
Get to the Senate, Mark. There are going to be bills waiting for you that are, as far as Social Security is concerned specifically, there's a wonderful bill in the House that we support that's a very moderate bill that will keep Social Security secure and solvent until the year 2100. But before we get there, we've got to fend off this bizarre recent challenge, which could destroy the program altogether. Similarly, with regard to Medicare, you know, these are programs, I said earlier that poverty rate would be over 50%, would have been over 50% if Social Security and Medicare had not been passed. If they go away today, the poverty rate among seniors in Arizona will jump to over 50% immediately again. This is not a thing of the past. This is a problem of the present and of the future. And there really is no other solution. There are very simple legislative solutions, you know, like for instance, talking about people, you know, Roman talked about his brother struggling to get to the age of 65. One thing that could be done with Medicare is to lower the age. It's a really sensible proposal because a lot of people do struggle, you know, problems start to happen between kind of 55 and 65. But unless we elect better people, we are not going to get to the work that really needs to be done. This is a country, we have the resources to make sure that everybody is healthy and secure and can live a life of dignity and independence in their later years. The way we get there is to elect people like Mark Kelly and send him to the Senate. That's what we have to do.
Well, thank you for that endorsement, John. I really appreciate it. Thank you for being here. Fran, Doug, Roberto, Roman, Dr. Tarkington, Gabby Giffords, thank you for joining me today and for sharing those experiences, which have shown that we have a lot of work ahead of us.
Yep.
And hearing about these challenges that our seniors face, it reminds me of why I'm running for the U.S. Senate. You know, all of you shared how Medicare and Social Security have played such a big role in your lives. And Arizona workers pay a lifetime, for a lifetime, or at least most of their lives, maybe not when they're little tiny kids, but certainly as adults, into these programs, and Washington is threatening to break its promise to Arizona seniors. We can't allow that to happen. So if I have the honor of being elected, I'm not going to let it happen. And I'm going to fight to protect and defend Social Security and Medicare from these cuts. And also thank you for sharing how the cost of rising prescription medication is hurting Arizona seniors. I'm going to work to lower the cost of prescription drugs, including, this is incredibly important, allowing Medicare to negotiate for lower prices. It's 30% of the pharmaceuticals that are sold in our country are sold under Medicare. To me, it's just fundamentally unfair that folks under Medicare have to pay more for prescription drugs than, say, somebody under another government program where they can negotiate the price. And finally, I think we all realize this. We all have to continue to work to slow the spread of this virus that has impacted Arizona seniors by making decisions. And if elected to the U.S. Senate, as we are likely to still be dealing with this virus, I'm going to be making decisions that are based on science and data and facts and not politics. So I look forward to continuing talking with all of you and other seniors across the state as we continue on this virtual tour. So for those who are watching today, I hope you join us for our next stop, hearing from seniors in tribal communities. We're going to do that on Friday. So thank you so much, everybody. See y'all soon, and please stay safe. Thank you.
Thank you.
Thank you.
You for inviting us.